Welcome to the Overcoming Addiction channel by me, Sandy R. Mays. Now, the focus of this channel is on identifying the cause and seeking solutions for substance misuse. Along with some of the basic principles from my own research, I'll share some of the data and research of clinical scientific professionals. I'm also going to share some of the latest statistics surrounding the mortality and recovery rate that highlights the impact illegal substances have on our community. Now, I'll also present some of the treatment options available. In this video, I'm going to primarily share some of the websites that I come across that offer help with the recovery and the reentry process for those seeking help. And I'll also post links in the comments section to a couple of the national programs and a few of the local ones. So, in the last video, I gave a few national statistics on substance abuse deaths according to gender and ethnicity groups, which I'll put up here. Now, in this video, we'll look at some numbers involving the demographic groups most affected by substance abuse in the city of Chicago. In 2018, fatal opioid overdoses occurred in 74 of 77 communities in the city of Chicago. In the same year, the rate of opioid-related death was highest among the ages 55 to 64 in Chicago. But in previous years, the rate had been like around 45 to 54. I can't explain the change in the ages, but that's something I'm working on. In 2019, there were 855 reported deaths from opioid abuse. In 2021, that number had risen up to 1,441 before we began to see a modest decline in 2022. Now, what these numbers indicate is that here in the city of Chicago, African American communities are the most vulnerable. But there is hope for those communities. Now, if you do a quick AI search, it will lead you to some websites of various government national institutions that address treatment for substance abuse. Now, it should be understood that the national institutions are the ones that are responsible for the research done for substance abuse and its treatments. States are then provided resources based on the results of these national studies, which in turn are distributed to our communities. One such national institution is called NIDA. Now, what is NIDA? Well, on May 14, 1974, an act of Congress established the National Institute on Drug Abuse, or the NIDA. And since then, it has been a leader in the world in finding and conducting research on drug use and addiction. The NIDA research has been instrumental in shifting the mindset of the public toward understanding addiction as a health condition that is preventable, treatable, and deserving of compassion and support. This institute supports and conducts research to develop and implement safe and effective treatments for substance use disorders. This includes research on new medications, brain stimulation, psychotherapies, and other innovative approaches. Now, another institute is the National Association of Addiction Treatment Providers. And on their website, there are treatment methods and practices which are used in treating substance abuse. Now, there's a link to both of these organizations in the comment sections. Addiction is different for every single person experiencing it. Factors like mental illnesses, trauma, and depending on the severity of the abuse, means that each patient requires a tailored treatment plan, especially with these new synthetic drugs in our communities now. And to further this goal, professionals utilize a variety of evidence-based approaches when treating drug and alcohol addiction. This list covers the most common methods used by rehabilitation centers and private practices nationwide. And some of these methods include, I have a short list, I'm not going to read them all. Cognitive behavioral therapy, or CBT, which is a type of psychotherapy. It's a conversational approach that involves structured one-on-one sessions with a mental health counselor. And the aim is to reshape the patient's negative thoughts. It also helps them work in early recovery to manage symptoms, to prevent relapse, learn coping mechanisms, and overcome emotional trauma. And it's also helpful in treating mental disorders. Another method is individual counseling, which is one-on-one talk therapy. And it is designed to help a person in recovery gain a better understanding of their addiction and the factors contributing to it. Another method is group counseling, which many may be familiar with. Now, experiential therapy is one that I am more interested in because it involves hands-on therapy. Experiential therapy is effective for the treatment of substance use disorder because it engages the patient's emotions. Participants explore subconscious thoughts and feelings through guided imagery. In this way, people who cannot articulate complex emotions or convey the details of their trauma may begin to be able to process them. Some examples of experiential therapy is art and music therapy. The family treatment approach. And this is where a counselor facilitates discussions and problem solving sessions with the entire group or with the family in some cases, because there's an educational component to it. And that includes, educating spouses, siblings, and parents, as well as children, on how to better understand the disease of addiction. Another one is motivational interviewing, where people use this methods to motivate them to seek changes and maintain changes. We all know about the 12-step programs. And there's the relapse prevention method. Now, all addiction treatment programs focus on preventing relapse. But the term relapse prevention refers to a specific intervention. It's a skill-based cognitive behavioral approach. Now, there are some relapse prevention strategies that include developing coping skills that address potential relapse triggers, learning how to say no in a clear, assertive way, planning for emergencies like sudden, intense urges and cravings, reinforcing confidence in the ability to abstain from drug and alcohol use. Relapse prevention seeks to identify potentially triggering situations and provide tools to overcome them. Now, the goal of this video is to help seek out solutions for the problem of substance misuse in our communities. And as I mentioned, there are community organizations for addressing the issue of substance misuse. Here's a few of them that some you may be familiar with and some you may not, but these are just a few organizations in Illinois where treatment for recovery is offered. One is the Salvation Army. And I think there's a few locations here. There's a website you can go to. Actually, I'm going to put a link to all of these programs in the comments section. There's the SASE Institute, and many of you may not be familiar with that institution, but I began my personal journey at the SASE Institute. And then there is the Recovery Orientated System of Care. Now, I've been fortunate enough to have participated in 3 of this organization's monthly meetings, 2 on the south side and 1 on the west side. And like I said, I'm going to keep saying this, there are links to all of these programs in the comments section. Now, like I said, my personal journey for recovery began at the SASE Institute, but it originated with prayer, because it was through prayer that I gained the determination to seek help for my addiction. And by the grace of God, I was steered in the directions that ended with my successful recovery from substance misuse. In the next video, I'm going to have some numbers, some encouraging numbers on how opioid deaths have declined over the last couple of years. And I'm also going to have some information on things like how do I find a good treatment program, how much does rehab cost, what is rehab like, and how to spiritually overcome misuse and remain substance free. So thanks for watching this video. I hope it was helpful. If you or someone you know is struggling with substance abuse or abuse of any kind, please seek help before it is too late. If you like, I can make some referrals on your behalf. My contact information is included in this video. If anyone has suggestions, comments, or questions, please contact me. Also, books are still on sale and the purchasing information is included in the flyer. If you like a signed copy, please email me to make mailing arrangements. Please don't forget to like and share. If not the channel, at least the information in the video. Start your own discussion. I appreciate all who have subscribed and followed this channel. I'll see you guys next time on another episode of Overcoming Addiction.